I'm currently the medical and IVF practice director of Vios St. Louis. I've been doing this close to a couple decades. So I'm a board certified reproductive endocrinologist and a board certified OBGYN. We opened Vios in 2015, and it's been a very, very fun ride. So Vios is trying to be a leading center in the United States and globally. And we really focus on sort of high touch point for patients, high technology.
And as well as seeing people all around the US and further afield, you do see people internationally as well, don't you?
Absolutely, I do.
So today we're going to discuss egg freezing. Please could you start by explaining what egg freezing means and what it is to people who may not?
Right. So, egg freezing in its kind of, most simplified description is really just that. It is freezing eggs for future use. So, just like we can freeze sperm for future use and freeze embryos for future use, the interesting thing, and one of the things I'm always passionate about is history and timelines, right? So if you think about it, IVF's been around almost, over 40 years, right? Which is a short time in the world of medicine, but also a long time if you look at, the number of babies born globally, which is probably over at least 8 to 10 million. And so, we've been freezing embryos for a very long time. Now, the first, as far as we know, recorded birth from a frozen egg was back in right around, 1986 or so. But back then, so if you think about it, the mature egg is a huge cell. It's a huge single cell, and it was fairly fragile to freeze and thaw. So there would be some ice crystals, and the success rates weren't very good back then with slow freezing techniques that we were using for embryos at that time. Now, they were a little better for embryos because embryos are a tight ball of little cells. So it's a better way to think about it. And so what happened kind of over the later 80s and 90s and early 2000s is freezing techniques got better. And there's a term we use called vitrification, which is an immediate glass-like state. It's kind of how I describe it. That's almost gentler to eggs with less ice crystals, and eggs do better with the freezing and thawing techniques with vitrification, which really started to change the field. And if you look at in the 2000s, we were freezing eggs usually under what we would call an IRB or an experimental protocol until we accumulated quite a bit of data. In the United States, that experimental label was removed in 2012. So to think about that, that's only, almost 10 years ago.
Yeah.
And so what, sort of has evolved is, this tendency to think about egg freezing only for emergency fertility preservation in cancer patients to really opening the door for a lot of different scenarios. Sometimes women who have lower egg pools, women who, are pursuing careers or want to build their family a little later in life, women who may be facing, a surgery, in certain genetic conditions. And we could go on and on about the indications for egg freezing, but kind of just to talk through that kind of history is really important to understand, where we were and where we are today.
Is egg freezing worth it, and who is it good for?
I always look at it this way. Every time I have a conversation with a woman about egg freezing, it is almost a little bit of a security blanket sometimes, right? The conversation I have is always to say, nothing is a guarantee. I mean, really nothing in life, I guess, besides death and taxes, right? But, when we look at egg freezing, the evolution of success rates have really made it a possibility for women for a variety of reasons. And one of the things that I'm fairly passionate about is the terminology that we use. So, there's a tendency to use terms like elective egg freezing, when really most times we are freezing for medical indications. Maybe it is the aging ovary. Maybe it is because that woman's egg pool is declining, right? For reasons we don't often understand: diminished ovarian reserve, evolving primary ovarian insufficiency, situations where maybe it's worsening endometriosis or conditions a woman may need surgery for. There are a lot of reasons women may elect to freeze eggs. If you look today, the average age at marriage and first live birth for a woman has increased by a minimum of 5 years. And, that's difficult. And in the sense of, so men make sperm every day of their lives. They have stem cells in the testicle and make new sperm. We don't make eggs, right? So our eggs age with us, and the ability to reproduce declines in our later 30s and definitely in our 40s. But if we want to carry a pregnancy in our early 40s with an egg that we froze in our early 30s, the success rates are tremendously better.
So do you ever see patients coming in because they've been educated on this and they just want to preserve their fertility, and they may be in their 20s or early 30s?
I do all the time. I think there's often a two-step process to it. Many women come in because they just want to understand what is their egg reserve. And maybe no one's really sort of offered them a look at their ovarian volumes or their antral follicle counts, where we count those little pea-sized follicles in the ovary, or a blood test called AMH, anti-Müllerian hormone, to also help understand the quantity of eggs. And I always talk quantity and quality. Now, none of those tests are perfect. None of those tests answer, can you get pregnant, yes or no, if you suddenly tried tomorrow. However, they are helpful in understanding ovarian responsiveness and how many eggs they may get. And that's step number one. So many women just want to understand their ovarian reserve and then make a decision based on that. Do I want to freeze now? Maybe I'll check in again in 6 months. Maybe I'm going to take this international job and come back in a year, and maybe I'll freeze eggs then. So sometimes it's planning, sometimes it's life goals. I talk to women all the time. Sometimes they're kind of in their mid-30s and they say to me, look, I haven't met a lifetime partner yet. I'm not sure if I want to move forward as a single parent. And I want to preserve that choice if I can, because if I meet someone at 38, 39, I might get pregnant then, but when I come back to have baby number 2 at 41, 42, that's going to be pretty difficult. And so it's family building options, it's personal choice, it's autonomy, it's, we can go through kind of all the ethics of everything for women, but I see patients all the time that come in and just want to understand their ovarian reserve and really understand those choices and the options for them.
Mm-hmm. And for people who are watching this and they're perhaps in their later 30s or their 40s and they're concerned that it's too late, what do you say to people who might be in that situation?
Yeah, I'm a big believer that there's no magic age where we're supposed to draw a line and say, you need to freeze your eggs only if you're under 35 or under 37. That's not necessarily true. Yes, does quality decline in our later 30s and 40s? Where by quality declining, what I mean is when those chromosomes go to line up and separate in embryo development, there's a higher chance of chromosomal abnormalities as the age of our egg increases. So sometimes we need more eggs to compensate for the quality issue. So where I counsel women, if they come in at say 38, 39, or even 40, 41, is how many eggs should I freeze, right? So you have to have more of a conversation on success rates. Very, center-specific success rates are very important because the techniques in the lab and the quality of your lab staff is very, very important, and something we find very important at Vios. But you have to have those important conversations with women. And if I told a woman that, she would have maybe a future 40% success rate with her eggs, or maybe it's 30, or maybe it's 60, depending on age and quantity, everyone sees that number differently, right? So, what's important to one person may be different to another person.
Absolutely. Did you hear that they've just extended the egg freezing limits in the UK?
I did, which made me happy.
Yeah, so it gives people a bit more choice, doesn't it?
Absolutely.
So if they decide to freeze eggs in 20s, there's no concern about, I need to know whether I'm going to be using them in 10 years' time.
Absolutely. Absolutely. And I think it's important. I had a conversation with a patient even just the other day, actually two patients who froze eggs almost before, in the US, we removed that experimental label. One was 2010, one was 2011. And even the little things that we do in the lab have evolved over time. When we freeze after the retrieval, when we strip the cells off the eggs, these are little nuanced things in the lab that improve success. So it's hard to predict sometimes when eggs are frozen that far back. Mm-hmm. However, I get this question all the time from patients. How long can I keep them frozen? Is there data? Is it okay to, keep them frozen 5 years or 10 years? And what does that look like? And, it's really exciting to sometimes see these patients with eggs frozen 10 years before and see them thaw well and see a beautiful blastocyst develop and see a pregnancy progress. It's just, this is where I think science is pretty cool, right?
Definitely. Because to your point before, some people may not have frozen their eggs because of many reasons, not thinking about it, it's expensive, not necessarily thinking they may need to because everyone hopes to meet a partner, don't they? So sometimes that choice is kind of taken out of your hands a bit, isn't it? And you don't look into the future. So it's good to know that there are still options for people who might be looking at doing it, who might be concerned that they've missed the boat.
Yeah.
How about how and where can people freeze their eggs in the USA?
Anytime, basically, is the answer. And so we freeze eggs at all of our centers, right? All of our IVF centers, and all of our providers are very, very well trained in egg freezing protocols. Our labs are very well trained. You can have a patient very much start the protocol technically at any point in her cycle, right? A lot of times we will start the process when a woman is maybe on her menstrual cycle, because sometimes that's when the ovaries are most at rest. I always say, that cycle day 1 is your first day of full flow. And then cycle day, 2, 3, 4 in there is when our brain is fairly quiet and our ovaries tend to be quiet, where we often should have, hopefully, the highest number of resting antral follicles in the ovaries. So we will start injections of FSH and LH gonadotropins to stimulate those ovaries. Those protocols often take, on average, maybe 8 to 12 days of stimulation and monitoring with ultrasound and blood work, and then an egg retrieval, which is about a 20-minute procedure under sedation. Make sure a woman's very comfortable. It's a vaginal ultrasound, and I always say, it's a poke on each side of the vaginal wall with a needle, very similar to the size of a needle sometimes when you get your blood drawn. So kind of you need to compare it to things that women know and understand. There's no incisions anywhere. It's a very doable procedure. And depending on kind of the protocol we use, sometimes women's ovaries are back to normal within the week and they're feeling like themselves. They feel a little bloated for a couple days, and that's common. So you can, though, if there's more urgency to the situation, really start that protocol at any point in a woman's cycle. So sometimes, if she's in the middle of her cycle, she might be growing a follicle, getting ready to ovulate, but we have the ability to recruit the next wave of follicles. So because we're not worried so much about the lining of the uterus, we're not planning an embryo transfer, that we can really start anytime in a woman's cycle. So for us, that means almost 365 days a year, right? So, we believe strongly we don't put women on waiting lists, for a slot in the lab. And, there's added anxiety that we try to avoid. And we actually, and many women are, career driven and their time off work matters, their travel time matters when they monitor with ultrasounds and blood work. So really building them a calendar around their ideal time makes it easier.
Definitely. So where are your locations in the US?
Yeah, in the US, so we are located in the St. Louis region. So we have three buildings in the St. Louis region: Southern Illinois, St. Louis, in West County, St. Louis. We have multiple offices in the Chicago region, both in the city and in the suburbs. We have offices in the Milwaukee region. We now have offices in Portland, Oregon, and so in sort of Vancouver, Washington area, just north of Portland. And now coming soon is Michigan too. So kind of the Detroit area that's opening very soon.
Fantastic. Traditionally, or at Vios, how much does egg freezing cost?
There's two big sort of pieces of cost that come in with egg freezing. One is the process, which is, the monitoring, the ultrasounds and blood work, the egg retrieval procedure, which is, an anesthesia-based surgical procedure, and then the lab cost to kind of strip those eggs, get them ready and freeze them. And usually most patients are paying forward that first year of storage. The other big cost is medications, right? So, medications and the amount of medications are strongly based on sort of that ovarian reserve. So patients who have, maybe lower ovarian reserve or lower ovarian responsiveness that require more meds might spend twice as much in medicines. So medicines, particularly in the United States, can be $3,000 to $6,000. And there's a big range depending on ovarian responsiveness. Very sort of important part of Vios to build packages for patients. So we have, where it's not just kind of a flat cost, we have 1, 2, 3 cycle packages. So, usually, and this really varies in the United States, patients can pay anywhere from probably about $6,000 to $12,000 in there. When you look at sort of the cost of ultrasounds, blood work, retrieval, anesthesia, lab storage for 1 year, for one cycle sometimes.
Yeah, that's really interesting to know. Thank you so much.
Yeah, absolutely.
Egg freezing success rates.
Yeah.
Where do you start with that?
As the medical and practice director, I'm responsible for working with the lab and reviewing our success rates. And we review them even on a Vios global level, so we understand we're always looking at all of our success rates. In general, I often say, if you're under 35, let's take the youngest sort of age group for a minute. If we really don't think there's underlying egg quality issues or infertility, we often say you probably need at least about 6 to 10 eggs frozen to have maybe a 60 to 70% chance of one live birth. It's kind of taking a lot of rough numbers and putting them together. It averages around high 80s. In some centers, it can be mid 80s to in that low 90s of survival rate at the time of thaw. You have to account for those things. When you're planning, you have to think, okay, I might lose an egg or two when I go to thaw them. When I'm ready to fertilize them, you have to use ICSI to help the sperm through the shell of the egg, because when an egg was frozen, it has a hard shell around it from that freeze-thaw process. And fertilization rates may only be around, 75% or upper 70s with ICSI. And then you have attrition in embryo development. And you hope of what fertilizes in a perfect world, you'd love to see at least 50 to 60% blast development rate. And so when you look at some of those numbers, that's an easy way to think about it from a numbers game. And it is a numbers game in many ways, when you're planning.
Yeah, it's going through those hurdles, isn't it, and reaching those milestones.
Absolutely.
Thank you. And any last thoughts or considerations for anyone who might be thinking about egg freezing for whatever reason or circumstance?
Yeah, it's a great question. I'm a big believer in the saying, knowledge is power. And, I think that, if you're even thinking about egg freezing, go talk to a reproductive endocrinologist. Just come talk to us. It's not always a commitment right away. It's gaining the knowledge and education around what is my ovarian reserve today. I just really want to know. I want to see where I sit. I want to hear about the process. I want to know what my options are. And I sometimes have some patients that really gather all the information and they say to me, look, my life is pretty crazy for the next 6 months. Maybe what I'd like to do is do this in 7 or 8 months. What do you think about that? And sometimes they say, I think that's perfectly fine. Sometimes if they come in at 41, 42, Every few months probably matters a little bit more than 31, 32. So really having a personalized conversation with your physician is really important. And so I think sometimes there's fear of technology and there's fear of taking that step, and it's the fear of the unknown. And sometimes just going in and having the conversation is really important. Just taking the time to do that.
I love that advice. Thank you so much, Dr. Cooper.
Absolutely. Thanks for having me.
And if anyone wants to get in touch with Vios Fertility Institute, what's the best way of doing so?
Yeah, I would really start by going to our main website, so viosfertility.com, and it really lists all of our locations. We have a very central, easy call number that you can call in, a new patient call center ready to help you the day you call. We have patient experience navigators to help you through your journey. And, I always tell my patients I'm really honored to be part of that journey. So.
Fantastic. And for people who might be coming from further overseas or just a different state, for example, are there people who can help coordinate that treatment plan?
Absolutely. So we have a full, patient experience navigator team. We have a full third-party team. We have nurse navigators. All of us physicians are very well trained to take care of patients wherever they may be within the U.S. or abroad.
Fantastic. Thank you so much. That was so insightful.
Yeah, thank you for having me. Have a fantastic day.